Welcome to this vlog where I'll assess movement deficiencies caused by either a skill or a capacity issue. Harry displays a good understanding of the movement, however it can be seen that his knees do not translate past his toes. Previously thought optimal, this was later challenged due to increased hip torque, leading to his chest to fall as seen by the movement. Highlighting a capacity issue in the hips and ankles. Lumbar flexion is also witnessed from the rear view, likely due to a limited hip mobility to gain extra depth. Harry's back squat also displays similar issues as his knees do not translate past his toes. He is however able to maintain a more neutral spine. There is still a considerable difference in the trunk and shin angle, highlighting a capacity issue in the hips and ankles. He is also unable to maintain the vertical bar path over his centre of mass, highlighting the compensatory forward movement of the chest. Looking at the rear view, there is excessive lumbar movement, likely due to the lack of range of movement about the hips to allow for the desired depth to be reached. The knee-to-wall test revealed limited dorsiflexion, particularly on Harry's left side. Dorsiflexion is crucial for squat depth, confirming an ankle mobility issue. To specifically assess Harry's hip mobility, I examined his internal rotation. Balanced internal rotation on both sides is crucial for maintaining squat depth and balance. The assessment revealed a 28% difference between legs, indicating a significant hip capacity issue. To address these limitations, I introduced several interventions. Dynamic hip openers, targeting the glute medius. These exercises improve internal rotation and challenge stability, enhancing neuromuscular control. Talus distraction. This technique allows the talus to glide posteriorly, improving tibial movement during dorsiflexion, as highlighted previously, an important determinant of squat performance. The knee over toe lunge movement promotes dorsiflexion while maintaining heel contact with the floor. It also incorporated hip extension and flexion. Exercises like split squats improve motor unit recruitment and neuromuscular control, benefiting the back squat both immediately and with consistent training. I placed plates under Harry's heels to simulate weightlifting shoes. These shoes encourage a more upright trunk and shin angle, reducing the ankle dorsiflexion required for squatting. Overall, the movement looks a lot better through increasing the mobility around his hips and ankles. While looking at the rear view, there is much less lumbar flexion, likely due to the reduced hip torque created by the knees being able to translate forwards, resulting in a more upright trunk. Post-intervention, Harry's squat showed a more upright chest positioning, knees able to translate past the toes, and a 27% reduction in trunk to shin angle difference, improving squat depth and efficiency. Harry's initial suboptimal squat patterns were caused by limited ankle and hip mobility, a capacity issue. However, this demonstrates how capacity limitations can indirectly affect execution, proving the importance of addressing physical capacities for better movement quality. Electra is new to the gym and presents with a skill issue in her back squat. For someone new to the gym, Electra demonstrates a generally good movement pattern, maintaining a neutral spine and achieves a hip depth below 90 degrees. However, she shows a knowledge gap about where her centre of pressure should be through her foot. She elevates her heels at the bottom of the squat, creating unnecessary reliance on her gastrocnemius and quadriceps. As a cyclist, it's natural for her to be quadricep dominant, but this elevated heel position makes her squat unstable. From the rear view, we see lateral knee movement, further indicating instability due to reduced surface area in contact with the ground during the squat. With added load, she continues to exhibit the same issues, including her elevated heels, but remains consistent in her movement. This consistency suggests a skill issue rather than a capacity issue. To address this, Electra was cued to keep her heels flat on the floor. While she was able to do so, it introduced new issues. Slight rounding of her spine, knees failing to translate forward. To rule out any capacity limitations, Electra underwent the same assessments as Harry. Electra showed excellent dorsiflexion, ruling out ankle mobility as a limiting factor. Her internal hip rotation was also strong, indicating no capacity issue here. With mobility ruled out, we focus on technique, using cues like heels on the floor, knees over toes, and push through your laces. Electra improved significantly from a side view. Her technique approached near optimal levels. However, From the back, she still displayed slight instability with lateral knee movement, suggesting a potential capacity issue in her glute medius, not producing enough force to keep her knees in line with her feet. Electra can now translate her knees over her toes and keep her feet flat on the floor. Initially, her movement pattern showed good capacity, but lacked the understanding of proper weight distribution through her feet. Clear cues helped her to develop the motor program required for a more optimal squat pattern. This, however, highlighted a capacity issue, displaying the dynamic interplay between skills and capacity. Over time, Harry has developed a skill issue in the hang clean. While Harry demonstrates a solid understanding of the movement and its basic mechanics, he admits that he hasn't performed a hang clean in over a year. This gap in practice is evident as he consistently fails to achieve full triple extension, which limits the amount of force he can generate. From a front-on view, Harry bends his arms prematurely to begin the pull before reaching triple extension. This sequencing error highlights a skill issue rather than a capacity limitation, as his movement lacks coordination between the phases of the lift. To help Harry relearn triple extension, I introduced the hang shrug as a derivative of the hang clean. This exercise isolates the second pull, teaching correct sequencing and coordination without the added complexity of bending the arms. By focusing solely on triple extension, the hang shrug enables Harry to generate maximum force and reinforce proper movement patterns. To further solidify this pattern, I had Harry perform a complex combining the hang shrug followed immediately by a hang clean. This allowed him to focus on achieving full triple extension during the hang shrug and then apply that skill in the subsequent hang clean. This complex enhances motor control, giving him a better feel for the proper technique. Upon retesting, Harry demonstrates a significant improvement. He was able to properly sequence the movement and achieve full triple extension before initiating the arm pull. This correction maximizes his capacity to perform the lift, allowing him to lift heavier loads until his strength and stability capacities are reached. A side-by-side comparison clearly shows the improvement. Harry's ankles, knees and hips have now reached full extension, confirming the re-establishment of the correct motor program. Harry's case highlights an important phenomenon that previously learned motor skills can degrade or adapt if they're not regularly practiced. This shows that even though a motor program may have been learned and retained, a skill issue can still arise due to a lack of use, emphasising the importance of consistent practice to maintain movement proficiency. Nathan exhibits a capacity issue in his hang clean, shown by his inability to catch the bar with his elbows in the correct position. While Nathan demonstrates excellent knowledge of the movement pattern, his restricted shoulder and thoracic mobility prevent his elbows from reaching parallel to the ground in the catch position. This limitation increases the load on his wrist and compromises his posture, particularly under heavier loads. Common causes of this capacity issue include limited thoracic mobility and reduced latissimus dorsi flexibility. To confirm this is a capacity issue rather than a skill issue, I assess Nathan's front squat. As seen in the front rack position, his elbows pointed towards the floor, reinforcing that this is a mobility limitation rather than a lack of knowledge about proper positioning. To address these limitations, I implemented two key interventions. The preacher stretch, to target thoracic and latissimus dorsi flexibility. Nathan held a stretch for at least 6 breaths, gradually going deeper with each breath, and a dynamic front rack stretch that focused on improving his range of motion dynamically by encouraging his elbows to rise as high as possible. Upon retesting Nathan's front squat, his ability to keep his elbows near parallel to the ground significantly improved, indicating increased range of motion in his shoulders. A pre and post comparison clearly showed an improvement in his shoulder mobility. When reassessing his hang clean, Nathan demonstrated enhanced shoulder mobility during the catch. This allowed him to maintain an upright posture, reduce the load on his wrist, and improved his stability throughout the lift. Additionally, he was able to catch the bar in a lower position, likely due to improved postural stability. To confirm these long-term successes, Nathan will need to sustain this technique under heavier loads. Nathan's case, alongside the other examples of skill and capacity deficiencies, highlight the interrelationship of skills and capacities. It demonstrates how movement compensation can arise from both skill and capacity limitations, highlighting the importance of addressing both for optimal performance.